A lot of people may have heard of a CT scan, but there are still a lot of questions out there.
It's essentially an x-ray, except it's a lot more detailed than your standard x-ray. It allows us to see a wide range of illnesses. We use it if you've had an accident, in sort of emergency situations, like if you've had a stroke or anything like that. It gives us a very detailed picture that we can use to help make you better or find out what's wrong or monitor that illness as it goes along. Pop your arms up above your head.
A lot of people ask whether the process makes you feel uncomfortable. Now, no one can deny it might feel unnatural being in there, but modern scanners have a large opening, so most people feel there is plenty of space. But if you have concerns, please discuss this with your radiographer. They will be able to reassure you.
Well, before I came, of course, it was the first time and it was quite nerve-wracking because I'd never seen the thing before. But actually, it was so relaxing, I almost fell asleep during it, and I came out with no problem at all.
Lovely, come on through.
Thank you. Before your scan starts, we will explain what to expect so that you're prepared for the experience. It's important that you remain nice and still during the scan. So now let's address a few more of those questions. A CT scan does use x-rays, but the reality is that you're far more likely to benefit from the scan than suffer any harm. To put it into perspective, a CT scan of your head is equivalent to the amount of background radiation you would normally get in 1 year. However, it is vital that you let us know if you are pregnant. Well, the actual scan usually only takes between 5 and 10 minutes, but you may be asked to arrive up to an hour before your scan to drink some water or be prepared for an injection. The answer is yes, but how you lay in the machine will depend on which scan you have. Mostly, you lay on your back. Sometimes your feet go in first, sometimes your head. And sometimes we have to immobilise a part of your body if, for example, you've damaged an arm or a leg.
It's going to ask you to breathe in and hold your breath.
We will, of course, fully prepare you for your scan. And for some CT scans, there are things we may have to ask you to do before you arrive.
So we ask our patients to contact us before their scans to let us know about any conditions that they might have, like diabetes, any medications they might be on, or if they might be pregnant. We also might ask them not to eat anything for up to 4 hours before they have their scan. Okay, sharp scratch coming.
For many CT scans, you may be given an injection of a medical dye that helps show up the different parts of the body, making the picture clearer. Now, some patients describe a warm, flushing sensation or a metallic taste, but these feelings pass quickly and we will ensure that you've recovered completely before you leave the department. When the scan is done, the images will be reviewed by a specialist, and there are thousands of images to look at. The results will be returned to your doctor. The bottom line is that a CT scan can produce important images of you that can't be gathered by other tests. As we said at the beginning, CT is a routine examination and a very important one for your treatment pathway.